Okay, so in this video I'd just like to talk to you about what communication is. It's a big topic, but just to give you some kind of a deeper understanding of what that means, and particularly what it means for children with autism and how it's different. So communication is something that we all do. Some people are very, very proficient at it, other people it can be a struggle. But from the very beginning, babies are communicating with their parents through body language, through sounds, through noises, through eye contact. So that communication starts from birth, and really babies are training their parents to understand them and to know that this particular cry means I'm hungry or I'm tired. And parents very quickly learn to understand their babies and to pick up on all those communication cues. And they're really the sort of what we call the foundations or the building blocks of communication happening during that first year, where babies are learning to send messages through eye contact, facial expressions, gestures, body language and sounds. And gradually that develops into words. It varies when that happens. For some children it might happen around 12 months, up to 18 months is a typical development. But obviously for some children that can be much later, and particularly for children with autism we often see a very delayed pattern in their actual acquisition of words. But what we need to really focus on is that communication is a two-way process. It is about expressing yourself, but it's also about the listening and the understanding side of things. And children learning to listen and to respond to other people is absolutely crucial, and those skills really need to come first before children can express themselves. So certainly for speech and language therapists, we spend most of our time, I would say, focusing on that side of things, is the listening, the understanding. So we need to work on those skills. Those building blocks need to be in place before we can move through the different stages and children starting to put words into sentences and building up to having a two-way conversation. And the way that children learn those skills is through being with their caregivers, with their parents, guardians, early years staff, and being in two-way interactions. That's how we learn to communicate. It has to be a two-way process. And really what we're looking at is being able to have joint attention. So if a little child is playing with a toy and is very focused and interested in it, if the adult joins them in that focus and attention and labels the toy, then the child can learn that new word and associate it with that thing. So that's that joint attention and that joint interaction that actually gets communication and interaction started. Obviously for children with autism, things are going a little bit differently, and they're not always following that smooth sort of typical pattern of development. So we need to focus on making sure that they have got those building blocks in place, and we're often working on some of the very early sort of behaviours of turn taking, responding, listening, rather than getting children to say words or to make sentences, because without that understanding it's very difficult to get to the top of the building blocks, to the top of the pyramid, and to be able to have a two-way conversation. So focusing on that joint attention and joint interaction is really important, because what we see for children with autism is that they often aren't as motivated to communicate as other children. So they're often very happy following their own agenda, doing things in their own way, and can sometimes have very strong interests in things that will occupy them for long periods of time. But that means that they're not spending that time in interactions, and it's only by being in that interaction that they can learn the communication skills. So we sometimes see what we call a mismatch between perhaps their ability to use words and language and their interest in communicating. So I've worked with many children who are perfectly able to say words very clearly, and can perhaps recite sections from favourite books or TV programmes, and the words are perfectly clear. They can copy those words, they can echo those words, and that's sometimes called echolalia. But they might struggle to actually ask for a drink or say that they need help, and that's because they've learnt to say the words, but they haven't understood that deeper sort of two-way communication that is really important to actually get messages across. So a lot of the time we need to focus on getting them to be motivated to communicate and ensuring that they can get those messages across. And the role of a speech and language therapist is really to work really closely with parents and nursery staff, other people that are important in the child's life, to make sure that they have the skills and the tools to know how to work through those building blocks and through those early stages, because it needs to happen all day, every day. Those interactions need to be happening throughout a child's day. And everybody knows that speech and language therapy resources aren't what we would want them to be, but even if they were, we as therapists, as professionals, are not the most important person in the child's life. And any time we spend with the child is only going to be a tiny drop of their overall picture, and it's that regular, continuous sort of exposure and practice they need. So as parents, you are the most important people, and you having the skills and the confidence and the support to be able to work on developing the child's communication interaction skills is really the foundation. And I will talk more about how we can develop that in other videos.